Te papatonga rewa, te whare tu nei tēnā koe. Nā te rua nui, te ati awa me ngā taranaki whānui, tēnā koutou, nā te tōrangatira karanga. Nā whānui o te whanganui aotara, tēnā koutou katoa, ki ngā kaiwhakahaere o tēnei kaupapa. Ngā tuakana e kite ana, nā kanohi, ki te kite au koutou a kanohi, tēnā koutou katoa. Ngā hāpai o I whakarite tēnei kaupapa, tēnā koutou. Ko Megan, ko Papa Viliami, pai te kitea korua anō. Ko Renei Ngawati ahau, he uri no Ngāti Hine, te mara o Hine Amaru, me te tai rāwhiti, he uri anō no Paraurangi, tēnā koutou tahu potiki. I'll hand it over to Sulita to do her mihi, and then we'll carry on, or akarere, and then we'll do our, carry on with our.
So rāna tātou katoa toi te aroa maata, tō tātou atu ko Yesu Mesia. Tarofa lava, nisa bulawa nā ka malo lelei, whakalofalahi atu. Kia ora, and I agree with our previous speaker, there isn't a country called Pacific, so I'm going to greet you with our tokoro greetings. Kia ora ana. I want to especially acknowledge before you many of my own mitua that are present here in the room, and I'm humbled that they're here for their particular type of work, but actually they are the ones that have paved the pathway for many of our Pacific organisations to have been able to begin to walk. And I want to acknowledge Margarita Potasi from our Pacific Health team, and of course my mama from my cervical screening great days of Tua at the back there. And there are many of you that continue to pave and be role models for us in our communities. As you heard, I come from the country. We come from the country. We don't have horses anymore, so that's very practical, and we've upgraded to some type of mobility aid to enable us to get around more. But I'm especially encouraged and want to thank Jim. I don't know if you remember me all those years ago. You do, eh? Lasting impression, eh? And I guess if I can apply that to any of these types of initiatives, that we leave those lasting impressions on our communities, on our whānaus, on our tamariki, then that is your legacy to work within the communities that we do. And so we're really appreciative of how you've contributed to that. But I'm especially proud of my researcher, and I'm going to pass it back to Sulita to be able to talk through the work that she's done.
Kia ora, nā talofa lava. My name's Sulita Povaru-Bourne. I'm a community researcher. And I was employed to do one day a week alongside another work colleague who's moved on to bigger and better things for herself. But I'm grateful to be in this space. I originally was born here in Wellington. I moved to Tokoroa because my grandparents migrated from the Cook Islands and they moved there. So then I moved there. So I grew up there, went to school there. And I've got Samoan father and I have a Cook Island mother. And yeah, it's me.
Sulita and I met up in Rotorua, was it last week? A couple of weeks ago?
Last week.
To discuss how we were going to tag team and do this. And really it's about not taking the mic too much from each other. So we're going to try real hard not to take over. Hey, you can take it.
Just by the way, ladies, I have other pals. So.
Yeah, well, hey, she's the danger. She's the danger. Before we get into our talking about the implementation network, we're going to do a bit of a whakamarama around who we are as organisations. Yeah. So it's my turn to talk about Toi Tangata. I want to acknowledge Megan and her role as the former CEO, and Dario Penetito Himara as the current CEO, and the mahi that they've done to grow Toi Tangata as an organisation. Why we are here in this kaupapa, I'm going to quickly do a quick exercise. I promise 30 seconds, Megan. Okay? So, tēnei marama I tēnei rā. The marama, or the phase of the moon today is okoro.
Okoro.
Coming out of whiro, the time for reflection. We are coming into the new rako nui, the new full moon, and so the energy is starting to grow. You maybe feel it in yourself. coming up to the full moon. So our energy is starting to grow. We're starting to think about what we're going to be doing, and starting to go get it for the next few weeks. Now, today is, what's today? Valentine's Day. It's Love Day. So I'm going to join those things together, but think about yourself and your self-love. So I want you to turn to someone next to you and you talk about one of these categories. Kai, kore tinana or physical activity, or how you rest or passive activity to give yourself some self-love. You have 30 seconds. Go.
That's good. So Daria was saying, I told you to like make it good.
Yeah.
Look at all this conversation going on. Needed.
We still got some loud noises, so you're still going. And 10, counting down, 5, 3, 2, 1. Kia ora. So now what I'm going to do is I'm going to divide the room into 4. So 1, 2, 3, 4. I want 2 people from out of this rōpū to say, each rōpū to call out something that they discussed. This quarter. Go. Nominate yourself. Go, Jim.
Go on.
Walking the dog.
Walking the dog. Perfect. One more from another category.
Oh, wait, fishing.
Go fishing. Wonky box. The wonky box. Whoop, whoop.
Yep, fishing.
Again, this quarter at the back here. One more. Fishing.
And go away from home.
Go away. away. Yep. This quarter. Over here at the back. Quarter 3. 2 people. Yep. Pardon? Yoga. Love it.
Yoga.
Any kai guys?
Yes.
Wine.
Yeah, I was falling in love with
Yeah.
Falling in love with food. Another one from this quarter? Come on, Dale. Taiao. Yeah, getting outside. Mean. Thank you, whānau. So, as we know, the cornerstones or the fundamentals of health are kai, physical activity or kore tinana, being able to rest, having the privilege to rest, wai oranga are some of those things. They directly contribute, as we know, to our hauora a hinengaro, and also tinana and wairua. Toi Tangata is an organisation that focuses on those things through whakapapa, through reo, through mātauranga Māori, to ensure it trickles down, or trickles across actually, to our hapori, our whānau Māori, through direct delivery, but also our workforce and how we whakamana our workforce to work confidently within our hapori. And that's through our partnerships through other organisations, which we'll talk about later, but through mātauranga. Go. Green line. Go. Oh, it's going back. See?
Go back.
Oh, no, it's ka pai. So, to acknowledge the stuff that Megan has spoken about before, this is a cute picture to depict the history of Toi Tangata as Te Hotu Manua Māori that was established out of a need to focus on the heart health, especially for our tāne Māori. So that's where the fundamentals came from around the addressing the risk factors for heart disease. But as Toi Tangata has evolved and the people that have come along, we've really focused on our mātauranga and our whakapapa as driving forces, and kai, being able to kore, being able to rest, being able to drink clean water, get out in the taiao, are byproducts of the work that we do. So through whakapapa and through mātauranga. So that's us as Toi Tangata in a nutshell, and I'll hand it over.
Okay. I'll just read Okay, we're a Pacific Island organisation based in Tokoroa, providing health and social services to the South Waikato. We work with babies through to our mamas and papas, and we work alongside our iwi and our mainstream partners. But if you want to add anything else.
Yeah, I actually want to do a little bit of an activity. So this side, do you all know the traditional Tokoroa Christmas song? It's called Jingle Bells. Do you all know that song? Now, all I want you to do is to to hum the tune. So this side is ping, 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 ping. Every time I point to you, you're going ping and keeping in time with the tune. This side, because you feel like a hong, hong, you're going to be singing pong, 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 ping, 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 pong, 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 ping. Okay? And my favourite back row, hey! Hey! All right. We're going to start here with Pong because yous were brilliant. It's never, and there is really a message underlying this, which is what is founded on our organisation. It's not that we need to be in the right notes or even going at the same tempo. It's that we're actually doing it together. That's all we really want, which is founded on our mission of caring for Pacific people today, for tomorrow, so that tomorrow we will be in tune, and it's okay where we are right now. We just need to be able to work together. So, jingle bells, that's your note, don't go higher or lower, and your pong, 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 ping, pong, pong. Watch me please, pay attention, that's another part of community relationships. Pong, 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 ping, 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 pong, ping, pong, ping, pong. Hey! Beautiful, hey? We'll consider you next year, well done. Straight up.
He whakamarama, what is the Healthier Lives Implementation Network? So this is a partnership between, leading up between the University of Waikato, so I want to mihi to John Oatel, who is our principal investigator and who's currently over in the United States, so he couldn't be here. Also the University of Otago. And I want to mihi to the network and to the National Science Challenge. And if I remember, I'll have a little kōrero about that too around Māori health research. Lots of words, but this flyer was made up as a whakamarama on the website, so the website's been established. But our goal was by working together and connecting through hui and whono, and the goal is to work and develop a community of providers, of community providers, researchers and health system representatives that can help facilitate the implementation of novel programs and interventions. How we interpret it in our initial hui was like a aka kumara or kumara vine, that the kōrero goes along, the gossip goes along, how us as Māori providers and Pacifica providers share information from research right through to funding, right through to programs being implemented. So this was like the co-design, the establishment of this kaupapa. So the network is made up of these community providers that were invited in, and I'll go through those things in a minute. Go. My left hand doesn't want to ding the button. All right. So there were 3 phases to this kaupapa. The first one was co-designing what the kaupapa looked like. What does an intervention network look like? How would it be implemented? Would it work? Is it the right language? Who wants to be involved in it? It was a real balance between what would work for Māori and Pacifica communities in terms of how you communicate it to the providers, but also what would work on a research sense and meet the criteria, if you like, for lack of a better word, in terms of implementation and funding, etc., and support. So that was made up of providers and a small amount of providers, and then it moved into a co-design where the invitation was put out wider around what the implementation network would focus on. It started off as looking at chronic disease, and it still involves that, but there were other things that came out of that we'll discuss. So phase 2 was co-design hui for both Pacifica and Māori providers, a series of interviews, semi-structured interviews, and a survey. And phase 3, which we are in currently, is looking at the implementation of pilots. get ready, Joe. Okay.
Okay, so we invited Māori and Pacific health providers across New Zealand to take part in the co-design discussion. And the opportunity was for them to really share with us what they thought were the needs for our communities. One of my learnings from the co-design discussions was the strong view to have a shared platform online and some way of being able to connect with one another. And that was a real strong theme that came across. But one of the challenges, and previous groups have said before us, is that finding that time, because although we put out the feelers to everyone to come on board and have those discussions with us, there was lots of things happening in our communities. And so the challenge was not only COVID-19, there was Cyclone Gabrielle, where some of our communities became welfare support for those families, for their communities. So at that time, that was the most important thing. So what we did was we worked with those providers that were available at the time. The other thing was when we went into the next part, we looked at the interviews and the surveys. And sorry. Yeah. So the process was the same. We reached out again to the same ones and others that weren't able to come on board with the co-design. And we asked them to come on board, and many of them wanted to come into this area because they felt like they could contribute to this part of the research. And but with that also came challenges. And there was learning, so I made lots of learnings with this as well. That every person or every organisation that came on board, everybody was passionate. They knew exactly what was needed in their community, and they felt like this is where they needed to contribute. One of my challenges was definitely the availability of participants, providers. Everybody wants to engage, but people just didn't have the time. And we just had to be patient. So right now, we've had to be patient with getting people on board. And we might think, oh, come on, get on board. But at the end of the day, if we're patient enough, that's the key learning, is that they will come on board when they find their time. So we might think, lots of things, but at the end of the day, our people, the time is precious, and we all know about, timing. And that was a lot about that.
Yep.
Did you want to add anything?
To support Sulita's kōrero around some of the outcomes of the interviews and the survey. So we both conducted interviews with some of the providers. So it was my job was to bring in some of the Māori health providers, and then Joe was a part of that, to discuss some of the enablers and the facilitators and the barriers to implementing programs, to inform the network around what it takes to implement a program in your community. And some of the barriers that were spoken about was the system constraints around how to deliver a program, when a contract is given or signed off, what parameters are around that, and some of the things that they discuss as being barriers. I want to connect to Max's kōrero this morning, the flow-on effect back towards the economic barriers.
Yeah.
And so it's the knowledge of knowing that we're working within this boundary or within these restrictions in order to implement a program. And we know we don't want to do a program, we want to do the whole thing. The lack of alignment of the program with the community. Part of this implementation network in the phase 3 was looking at implementing pilot programs in communities, and that will kind of be an evidence base for this kaupapa to see what those facilitators and barriers are. And does it work for that community? Do we adapt it, and how can we make it work? The lack of engagement with the community, that was varied. That was more around the ability to be able to make relationships depending on the location of the hauora, where whānau are. When new staff members come in, they have to do whakawhanaunga all over again, and the priorities may be different given COVID-19. And so the priorities of the hauora went right back to whanaungatanga, right back to the fundamentals of relationships. And of course, the lack of funding. Facilitators, strong leadership, having people driven, trusting relationships with others, so the whanaungatanga between community, hapori, whānau, the providers, funders, and researchers, of course. Sharing information about what works with others. So this is the crux of the implementation network, is sharing the information and how we do that safely, and how we do that with mana, and how we do that with ease, and of course information that people can understand. This is a reality that Sulita and I spoke about, especially in the kaupapa, and researchers know this. The language that we speak to our people, the language that we speak to the researchers, the team, the funders, is a constraint in itself, and making sure that they're both the same but in different reo almost, that suits them, and that takes skill. This is she's me. So sharing that information allowed for one iwi or other providers to take action in whatever way they felt like. Some iwi were like, oh, I didn't even think of that. So that's a quote from one of the interviews, was the potential for this implementation network to service that. From one of our co-design, it's been on the top of my mind actually, leading up to this kaupapa. One of the feedback from the hui that we had was, it's not just about chronic disease, it's about how do we have funding opportunities, how do we have share information around that, how did you approach this, and also validation of some of the approaches, especially when they want to do research on our babies in kohanga reo. And what does that look like when researchers go in that can't speak te reo Māori? And so when we hear and see those stories, it's validation for others. And another quick story was that a woman shared that her need for mātauranga-based approaches to validate her mahi when whānau come to her for information around health issues or whānau issues, and they want mātauranga-based approaches. So it's about them learning this and going on this journey and this. So the example was around ikura or periods for their babies, or for their kohine. And so where is that information? Is this a potential for that? So I'll just add that on. Okay.
Yeah.
Right.
And so
Phase
implementation, we're working with two Pacific providers, Ava Nui Pacifica, which is based in Tauranga, who have decided to take on the Ola Ora, which you would have seen up on the screen earlier. They've decided to take that on and pilot that program and try and implement it in with their Mamas and Papas group, the young mums group, and some of the clients that are coming through their clinic. And then our other one is Village Collective, and I like to acknowledge Village Collective because they're at the back here, and they've come on board and they're just deciding right now which program do they want to implement, which program matters to them in their community. So we're looking forward to that kind of work that we're going to be doing and looking at some of the results that many of you have already implemented before.
I managed to get some pictures. So through Toi Tangata and the relationships that Toi Tangata has with some of the hauora, we managed to get two awesome hauora on board for the implementation phase. And I want to acknowledge all the other hauora that wanted to be a part of it, but again, it was around their underfunded overmahid. And so, how do they do that? And also to acknowledge that programs that focus on, kaioranga and koritinana, and all those types of things, they're already doing it out there in the world, and sometimes adding another program was a bit of it was just too much. Yeah. And so how did we make that work? So I want to acknowledge, the tohu didn't come up, acknowledge Te Papa Tākoro Te Arawa. They jumped on board. They do koritinana kaioranga and deliver tākoro initiatives in their community in Rotorua and Te Aroha Whānui. So they had a whakaro, they had a thought around how do they bring in tāne Māori in a kaupapa that they're already doing, and we can snag them that way. And so Te Papa Tākoro's approach was through kapahaka. whānau are there, kids are there, they're all there, they're all together. If one goes, they all go. And so I think we're concentrating on 5 rōpū that are preparing for their regional competitions in March. And so in the implementation phase, the organisations, the hauora, were to choose from a series of programs that had already been implemented, like Ola Ora, and Pautiri Tāne Hauora was one of them. So that's what Te Papa Tākoro chose, but they've adapted it to their community, adapted it to their whānau. Wahine go along too, but they're not part of the data collection. And so we've supported, or Te Papa Tākoro has supported the rōpū with their kapahaka group to go along to the gym of their choice and be supported to do that as they go, our whānau. So that's one. 4 minutes. Oh, that's heaps. And the second rōpū is Te Hiku Hauora. Stand up, Joe. Stand up, move there. So Joe has agreed to support this kaupapa, and we've been in conversation, and Joe's a real advocate and a real māngai in the whole spectrum of determinants of health, from economic, social and economic, right through to our tepu, the kai that we have in the tepu, and the ability to feed our pepe. And so, how do you narrow it down to one program to make an impact? And so she came to us and said, I want to do all this, and this, and package it up. And so we said, yes. And so it's the long-term investment. If this is one step in the long-term investment to reduce the risk of chronic disease for our whānau through the oranga of our mama. And so, I'm getting this right, aren't I? So oranga mama, oranga whānau, and addressing on the fundamentals, all those, the fundamentals that we spoke about before around kai, kore, whānau supports, ahine-ngaro, and the impact that it has on the self-efficacy. And so self-efficacy is something that is a product of just having good kai, good rest, and all those types of things. So I want to mihi to Joe for acknowledging that as well. So that's happening over the next little while. That's the implementation phase. But I wanted to talk about ngā tirohanga, or some of the things that we 2 minutes heaps. Some of the things that we spoke about in our interviews. So when it comes to mātauranga Māori, or I can speak to Māori public health, is that we know what empirical evidence is according to Te Ao Māori. There is no evidence base, because the chicken and the egg cycle is what you need for the money to resource the research or evaluation or to validate the kaupapa, but you don't have the money. So then there it is. You need the money for the kaupapa, then you need the money for the resource to evidence the kaupapa, and you can read the rest. And so that quote was really important out of the interviews to depict the cycle of the support that we need to validate, without using that word validation, for the mahi that Joe, Toi Tangata, Te Papa Tākoro already do. And we shouldn't have to go through this process to be able to get the evidence for our people. Sometimes we have to flip the switch. So that's the kind of the wero to the National Science Challenge. But in saying that, it's important to get those voices out on how we do stuff in our community.
Yep, we'll just close off this part. We'd like to thank the Ministry of Health and the Healthier Lives National Science Challenge for this invitation and for the funding that's come to us. Also the providers who have been along this journey, which are these ones up here. Our advisory board for the ongoing support for the project team, and we're just excited to see what's going to happen. And there's still a lot of work to come, but yeah.
Yeah. That's us.